Assalamu alaikum. In this video, we will see the arterial and venous system, that is blood supply of human body. I will try to describe all the named arteries and veins of the body and their supply grossly. Okay, so let's start from left ventricle of the heart. From the left ventricle, the aorta arises as ascending aorta. In ascending aorta, after just it arises, it gives three dilatation, one anteriorly and two posteriorly. These are called aortic sinuses. From the anterior aortic sinus, right coronary artery arises. From the left posterior aortic sinus, left coronary artery arises, and this left coronary artery supply the most of the left ventricle of heart, left atrium part of right ventricle adjacent to the anterior interventricular groove. Okay, then right coronary artery arises from the anterior aortic sinus and gives supplies to the whole right atrium, most of the right ventricle except the part supplied by the left coronary artery, and also it gives supplies to part of left ventricle adjacent to the posterior interventricular groove. The right coronary artery gives supply to the conducting system of the heart, that is SA node and AV node in most of the cases. So by this we just ended with the coronary circulation. Then the ascending aorta arises and become arch of the aorta. Let's start with arch of the aorta. So arch of the aorta begins and ends at the level of angle of Lewis, that is T4 or thoracic 4 vertebrae. It gives three branches. One is brachiocephalic and one is left common carotid and another one is left subclavian. Then the brachiocephalic artery further divide into right subclavian and right common carotid artery. Then arch of aorta ends and become descending thoracic aorta and give the branches to the mediastinal viscera and to the wall of the thorax by intercostal arteries. And the visceral arteries are mainly tracheal branches, esophageal branches, etc. etc. Let's move to common carotid artery. The both sides common carotid artery give similar courses and branches. Common carotid artery mainly supplies the area of head and neck. So we will describe only one side as it is same to the other side. So from brachiocephalic trunk in right side and from arch of the aorta in left side, it arises and ascends through the anterior triangle of neck, and it divide into external and internal carotid artery at the level of cervical 4 vertebrae or at the upper border of thyroid cartilage. Then the external carotid artery gives some branches around the face area, and internal carotid artery has no branch outside the cranium, and it just ascends through the carotid canal and give intracranial branches. So first come to external carotid artery branches. So external carotid artery gives many branches. There are 3 anterior branches, 2 posterior branches, 1 medial or deep branch, and another 2 terminal branches. So first come to the anterior branches. There are superior thyroid artery, there are lingual and facial artery comes from anteriorly. Then there are 2 posterior branches from external carotid artery. These are occipital artery and posterior auricular artery. And there is only 1 medial branch which is ascending pharyngeal artery, and the terminal branches are maxillary artery and superficial temporal artery. By giving these terminal branches at the level of back of the neck of the mandible, it ends. Then come to internal carotid artery. Internal carotid artery just ascend, and through the carotid canal it goes to the cranium and gives some branches and contributes in circle of Willis. Let's see circle of Willis. Inside the cranium, internal carotid artery gives some branches which supplies mainly brain and intracranial other structures. The major branches are middle cerebral artery, anterior cerebral artery, posterior communicating artery. There are also some minor branches. These are superior hypophyseal artery, choroidal artery, and ophthalmic artery. There are also inferior hypophyseal and hypothalamic artery. Here we finish the carotid system. So next we will see the subclavian arterial system. So subclavian artery arises and goes laterally between the anterior scalene and middle scalene muscle, and it become 3 parts. First part of subclavian artery is proximal to the anterior scalene muscle. Second part of subclavian artery is behind the anterior scalene muscle, and third part of subclavian artery is lateral or distal to the anterior scalene muscle. So first part gives 3 branches. One is vertebral artery, one is thyrocervical trunk, and another one is internal mammary or internal thoracic artery. Second part give rise only 1 branch, that is costocervical trunk, and third part gives only 1 branch, it is dorsal scapular artery. Then after passing the lateral portion of the first rib, it take the name as axillary artery. Then move to axillary artery. Axillary artery has mainly 3 parts, and it is divided by mainly pectoralis minor muscle. Proximal to pectoralis minor muscle, it is called first part. Behind the pectoralis minor muscle, it called second part, and lateral to the pectoralis minor muscle, it is third part of axillary artery. First part of axillary artery give rise only 1 branch. Second part of axillary artery give rises 2 branches, and third part of axillary artery give rises 3 branches. So now we will see the name of the branches. So from first part of axillary artery, superior thoracic artery is arises. From second part, thoracoacromial artery and lateral thoracic artery is arises, and from the third part, subscapular artery and anterior and posterior humeral circumflex arteries are arises. Then the axillary artery crosses the teres major muscle level and it become brachial artery. So let's move to the brachial artery. So brachial artery descends and gives some branches in the arm. It gives the branch called deep brachial artery or profunda brachii artery. It supplies the deep structures of the arm, and there is also superior ulnar collateral artery and inferior ulnar collateral artery. These all artery anastomosis around the elbow joint and give supply to the elbow joint. At the level of elbow joint, the brachial artery lies medially to the tendon of biceps brachii, and after elbow joint, immediately after elbow joint, it become divided and become two branches. One is ulnar artery and one is radial artery. So let's get into the ulnar and radial artery. Ulnar artery runs along the ulnar border of the forearm, and radial artery runs along the radial border of the forearm. From usually ulnar artery, there is another branch arises called common interossei artery. Then this interossei artery divided into two branches. One is anterior interossei artery and one is posterior interossei artery. These arteries give supplies to the deep structure of the forearm. At the level of wrist joint, the both ulnar and radial artery divided into two branches. One is superficial palmar branch and another one is deep palmar branch. These superficial and deep palmar branch make superficial and deep palmar arches, and these arches supplies the hand, and by this we finish the arterial supply of the upper extremity. So after finishing this, we will move to the descending thoracic aorta. Let's go to that part of blood supply. Descending aorta pass through the aortic opening at the level of T12 vertebra, just in front of this vertebra in midline, and it become abdominal aorta. After becoming abdominal aorta, it gives some branches. We will see these branches now. So there are some paired branches and there are some unpaired branches. At the level of T12, just after piercing the diaphragm, it gives two branches, which is inferior phrenic artery. These arteries supplies the diaphragm muscle. There are three anterior unpaired branches which supplies the abdominal viscera. One is celiac trunk, arises from the level of T12. Another one is superior mesenteric artery, arises from the level of L1, and another one is inferior mesenteric artery, arises from the level of L3. Celiac trunk supplies mainly parts arises from the foregut, that is from lower portion of esophagus to the major duodenal papilla of second part of duodenum. Then after that, from the second part of duodenum, after major duodenal papilla to the proximal 2/3 of transverse colon is supplied by the superior mesenteric artery, and then from the lateral or distal 1/3 of the transverse colon to the anal canal, that is up to pectinate line, inferior mesenteric artery supplies. There are some lateral paired branches arises from the abdominal aorta. These are middle suprarenal artery, then renal arteries, then 4 pair of lumbar arteries, and it divides into left and right common iliac artery at the level of L4, and it also gives rises gonadal arteries. And there is also another posterior unpaired branch at the level of L4, that is median sacral artery, and by dividing into two common iliac artery at the level of L4, the abdominal aorta ends, and we can see the common iliac artery then divide into external and internal iliac artery. Internal iliac artery gives supplies mainly to the pelvic viscera, and external iliac artery mainly goes downwards to the inferior extremity. And after passing the inguinal area, that is at the level of inguinal ligament, the external iliac artery become femoral artery. So let's get started with femoral artery. So femoral artery descends downward and it gives the profunda femoris artery. This profunda femoris artery again gives two important branches. One is medial circumflex femoral artery and another one is lateral circumflex femoral artery. All these artery gives the supply to the thigh deep structures, and femoral artery descends along the medial surface of the medial portion of the thigh and go through the adductor hiatus and adductor canal to the popliteal fossa, and it become popliteal artery. Then it descends down through the diamond shaped popliteal fossa, and at the level of upper part of the tibia it also divide into some branches. So let's get to the popliteal artery. Popliteal artery give branch called anterior tibial artery, which comes to the anterior surface of the leg by piercing the interosseous membrane between tibia and fibula at the upper end, and gives supplies to the anterior compartment of leg. And the tibioperoneal trunk is the remain artery, and then the tibioperoneal trunk also divide into two arteries. One is peroneal artery and one is posterior tibial artery. Peroneal artery gives supplies to the lateral compartment of leg, and posterior tibial artery gives supplies to the posterior compartment of leg, both superficial and deep posterior compartment. Then it descends down at the level of ankle joints and gives supplies to the foot. So let go to the foot. So in foot, after crossing the extensor retinaculum, the anterior tibial artery become dorsalis pedis artery, and this dorsalis pedis artery gives arcuate artery and deep plantar artery. This deep plantar artery goes to the deeper structure, and arcuate artery gives supplies to the superficial part of the dorsum of the foot. Posterior tibial artery at the plantar surface of foot gives two branches. These are the medial plantar artery and lateral plantar artery. Medial plantar artery gives supplies to the medial portion of the plantar surface of the foot, and lateral plantar artery make an arch and it anastomosis with the deep plantar arch, which was a continuation of arteria dorsalis pedis, and by this we finish the arterial supply of the lower extremity. Alhamdulillah, we finished the arterial supply of the whole human body very superficially or very grossly. Then we will talk about also the venous drainage of the human body from the periphery to the heart. This video was from heart to periphery, and the venous system will show the blood circulation from periphery to the heart. Hope you will enjoy also that video. Thank you for watching.